I guess the best way to start would be by presenting what we know about the history of this practice. Where did it come from? Kind of when did it take off, and why? So we've done a little bit of research on this, and from what it looks like, this is a practice that really didn't get, I'm sure urine screening, I'm sure the technology was available way before the 1980s, but it was the 1980s. And once again, we have the Reagan administration to thank, this time, Ronald.
And Nancy. Say no.
we've harassed her a little already, but I had no idea that this, when it started, I thought it was a punitive thing, like maybe they did it for criminals, and that is not actually the case. It turns out that the reason it took off was more for economic reasons, because in the early 80s, the US was, really starting to pick up steam as a global leader. They needed every worker they could performing at top capacity. This is the way they felt. They wanted to, big business corporations were looking for the perfect employee, basically. So there became this drive to find people who were reliable, efficient, and who could compete on the world stage. That's the idea. In 1986, Ronald Reagan issued an executive order entitled Drug-Free Federal Workplace. Mostly it was the transport industry that they were focused on. They were looking at airline pilots. They were looking at truck drivers. They were looking at, how do we stop the motor vehicle accidents, that kind of thing. Mm-hmm. And then it sort of morphed into this creature that's where employers deciding to enact drug testing policies in the workplace, and it became human rights issue from there on. But it was actually, I'm surprised at how easily it was kind of assimilated into the culture down there. And then by the end of the 80s and close to the 90s, it was pretty ubiquitous throughout the States, where corporations were routinely testing. And the motives behind that, some of these things they stated as reasons or justifications for testing: reducing the demand for illegal drugs, which is pretty wild. There's quite a bit of kind of a labyrinth of ideas has to happen. Yeah. And somewhere you get caught in the middle to come to the conclusion that testing for illicit substances, right? And they would have to be illicit. So is another area where people were raising their eyebrows, like, what is this testing about? What about Bob over there who's like nodding off at 1 p.m. because he's got a Percocet prescription that would take down a full-size moose? Mm-hmm. At the time, they didn't. The illicit or illegal drugs were, I guess, kind of seen in very much as a different entity to pharmaceutical drugs, that continues to be a thing, right?
For sure it does.
And
was this a push against cocaine specifically?
Cocaine, opiates, and alcohol were the main ones thereafter. Oh, and cannabis. They didn't like cannabis, because the idea at the time, and still for some people, man, I can't believe it. Do you think you want an example of a guy who's not lazy and smokes a lot of cannabis? Maybe go check out Joe Rogan. If you can keep up with him in either one of those categories, the amount of cannabis he's taking and the amount of activities he's doing, the amount he's learning, his general health. Yeah, it's many people. It's funny that people still think of cannabis in those blanket terms.
Yeah. So what's the other one?
Enhancing employee productivity.
Mm-hmm.
Which is, I think this is pretty funny, because fast forward 30 years and look at the tech world. If they're not microdosing for innovation purposes to increase your mind's ability or capacity for creativity, then they're on Adderall.
And caffeine.
And caffeine.
Yeah.
I mean, I've always noticed that in our culture, the drugs that are frowned upon the most are the ones that are most likely to have an impact, not on your safety so much. I mean, with alcohol sometimes, but it's generally your productivity. That always made me kind of suspicious, even when I was younger. How come certain drugs are allowed? How come smoking was so popular? And then we looked at what it was doing. Now the cigarettes are generally gone, replaced by other nicotine sources like vaping and stuff like that, or stimulants. It's interesting that an organization could think, like, if you're working for a company and your boss comes up to you and says, "We're going to need a random urine sample from you, Corey, because we're worried about employee productivity, and we want to do our part to reduce the demand for illegal drugs in this country. And also, we feel that if we do these random urine drug screens, we'll reduce the likelihood of employee theft because you're probably going to have to steal to support your illicit drug addiction or problem."
Yeah.
So, I mean, if you're faced with those kind of reasons, that doesn't seem very compelling, right?
No. Did you ever in your I'll say pre-exposure days, when you were actively using opiates at work, did you ever worry or have the thought, like, what if random drug testing is asked of me?
No, because it's not something I would entertain. Like, if if it was a random policy that was just put in place on a group of people who are all working, it would never fly legally. Like, it just not in Canada, and it didn't in Canada in that way. And I, at least at that time, back when we had I don't know, more intelligent people at the wheel, I guess.
The thing that always made me think, I did used to think about it, just wonder about it. At least, not, it wasn't even something I really can say that I worried about, but I wondered about it, and I always concluded that they would have such a mess on their hands that what would they being the employer, what would they do? Like, they would have thousands of employees to somehow sort and filter through the machine, but they would have to do, I don't know what they would do. They would, and I don't think they would know what to do with that. Like, they would have a mess.
Yes, they'd have a mess. Like, could you imagine if you were to do, like, if you went into a hospital and said, "Okay, everybody,
yeah,
this is random test day." The amount of work, first of all, because our current tests are not sufficiently precise enough or accurate enough, both of those things actually, to determine when a person took a substance. It's not accurate enough to really do anything to tell you whether or not that employee is impaired.
Right.
It might say, okay, this person has an above normal level of THC, or look at this guy, he's got quite a bit of cocaine in his urine right now, cocaine metabolites. So then you'd have to, like you said, sort all those people who test positive. So you're probably looking at 10% of your entire staff. Mm-hmm. And then you're going to have to send them all for more precise results so you could try to get some kind of an idea when they took these substances. It would be a mess. Yeah. And then, okay, so you've got all these people here. My idea or thoughts about this are generally surrounding your ability to function as an employee. So, if you're going to let people take pharmaceuticals and go to work, and I'm not advocating for people in safety sensitive or safety critical, like airline pilots and stuff like that. Obviously, they should have as clear a mind as possible. But in some jobs, does it make enough of a difference? Like, is your cognitive function impaired?
Right.
Because the way it is now, especially in the States, if you read articles out of the States, they always say blah 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 was impaired. And impaired means that they just took a drug. Like it's just assumed that if you took the drug, you're impaired.
Yeah.
When that is pretty strange, considering we test people in the Olympics for performance enhancing drugs.
Yeah.
They are clearly not impaired by the compounds that they're taking.
Right.
You know, so
And I would challenge that myself included, when I was working night shifts, and the vast number of healthcare workers that I know or knew who worked night shifts, by the end of that 12 hours, by 6 o'clock in the morning, in the last hour of your shift, you are quite impaired.
yes.
And there were times I would drive home after a night shift and think, I don't think I should have driven home. Like your vision, your reaction time are all, sluggish or worse.
Yeah, I've seen studies that compared lack of sleep with, they can do a direct comparison or correlation with, you go this long without proper sleep in an environment, it's like having 2 beers. You go this long, it's like having a 6-pack. So, I mean, the way doctors are expected to work, especially early on, or if they're an emerge doc, they might go a day or two sometimes.
Mm-hmm.
And then what happens? They get off shift, they get in their car and they drive home.
Yeah.
Like, I know we're not living in a perfect world, but we have to start looking at these nuances a little more carefully.